Oh, glad you're still with us. If you're just joining us, karibu tena sana. This is Good Morning Kenya. My name is Jain Wambui. You can talk to us. Let us know where you're watching us from this morning using the hashtag Good Morning Kenya on Twitter. Our station handle is at KBC Channel 1 and my handle is at Jain Wambui across all the social media platforms. So we are having a conversation about our eyes, and we've gotten the foundation done. We've gotten to understand the basics, what you need to look out for. But now comes in issues to do with myths and misconceptions about eyes. We have grown up understanding so many myths being told about our eyes. If you do this, this will happen. If you don't do that, this will happen. But we just want to get clarity in regards to some of these issues. And let me start with you. I have three gentlemen with me in studio this morning, in case you're just joining us once again. We have Deepak Anthoni, who is an optometrist and also a member of the Overseas Friends of Bhatia Janta Association. We also have, and that is on the top left of your screen, that is Deepak. We also have Muktesh Gupta, who's also an optometrist and also a member of the Overseas Friends of Bhatia Janta Association. And to the bottom left of the screen, we have Aloysius Njoroge, who is the project coordinator and the local partner representing the Machua Waithaka Foundation. Those are the gentlemen with me in studio helping with this conversation. And let me start with you, Deepak. And I want to start with the one that you had mentioned about those of us wearing glasses. We were always told if you have an eye problem and you put on glasses, over the years your eyes will sink into the pockets. Is there any truth to that?
Well, this is one of the most common myths we often encounter in the clinic. And I don't want to wear glasses even though my eyesight is bad because it will interfere with my look.
Yeah.
But basically this is an outside aid, medical aid, which is helping you to give the sight properly. It is not going inside your system or something. So when we put the glasses on and the people around us starts looking at us in a certain way, and suddenly when we remove it, then it's missing from there. And then the eyes feels like, oh, it is sinking now. But scientifically, there is no reason for the eyeglasses and the eyes to sink inside. So it's basically a myth.
There's no scientific backing that supports that, so it's a myth.
It's an absolute myth, yeah.
All right. I've been wearing glasses since I was in class 6, and my eyes have not sunk. And it was something that I used to believe as well. At some point, I would try to wean myself off my glasses, and I would always squint in class because I don't want my eyes to sink. So that's a very big misconception that we need to let go of, especially for our children. Now, let me come to you, Muktesh, and I'd like to get, and this is from a medical point of view, that when it comes to eyesight, only men are colorblind. What do you have to say about that? Is there any truth to that?
No.
No?
It's privilege, yes.
Yes. Maybe you could give us some bit of explanation to understand that it's not just a male thing.
No, it is not actually. It can be either woman's side or the man's side.
Yes.
Even the children, sometimes it's affected with the color blindness.
Okay.
So it's not...
It's not just a man thing?
Yes.
Okay. Deepak, you had something to add on to that?
The prevalence of the color blindness we have noticed, or the study has gone on. So it shows more towards the man's side because related with the genetic part of it.
Okay.
So the Y chromosome is more responsible on it. That is the reason we see the prevalence of the color blindness is more towards the man. So it has become like a, again, misconception that this is a man kind of defect.
Because most men are the ones who have been found to be having colorblind issues, but it's not just exclusively
with them, yeah.
For men.
True.
All right. Njoroge, I want you to come in at this particular point, and it's something that you had mentioned about being cross-eyed, and I want to even hear from you, given the information you have seen, that if you cross your eyes, they will remain like that. That is a myth that I have grown up knowing.
Well, I think that's something that I started a long time ago, having my eyes closed. It used to work like magic.
Yeah.
I would hold the finger from afar to make it now. Then I would bring it close. And as I'm watching it, the pupils would be focusing on one particular place.
Yeah.
And I learned to do it even without even focusing on that. And my eyes have never crossed. I used to do it in primary school. I would scare some other kids, you know. When somebody comes to me, I would close my eyes and make a face, you know. And, you know, with those myths and those misconceptions, as you say, I would also make these kids also, you know, I think he can change, you know. So they would think you have some magical powers or something like that.
But it's a complete myth?
It's a complete myth. I've been doing it for the last, I can't even do it. I do it anytime. Sometimes it even became a habit. Like, you'd say something that I feel upon, and this is, I would close my eyes, you know. What are you talking about? The cartoon style, you know.
Deepak, from a medical standing, your thoughts?
Well, I totally agree with Mr. Njoroge. It's a myth. Rather, I will add up there, cross eyes or exercising this kind of game with you in the childhood. It's rather good because that's a convergence exercise. So when we do the convergence, we are rotating our muscles inside and all that. So moving all the eyes, bringing it there. In fact, if people who has developed with a squinting eye because of some refractive errors and some other reasons, there are so many conditions where we advise to do this exercise. As he said, we used to focus on the tip of the finger or any pointed thing and bring it closer. So we do advise people to do this convergence exercise, which we technically call it push-up test. Push-up as in,
push-up
exactly, the name is very common. So we do the push-up test to bring the convergence and bring the mobility, the ocular motility, to strengthen it. So that the movement of the eyes will remain proper. And it's a good for health, eye health.
All right, so exercise for the eyes as well.
Wow. Yes, so continue doing that.
Yes, and finally, let me come back to you, Muktesh. When it comes to myths or misconception, there's this notion that eye problems are inheritable. If your parents have any eye conditions, short-sighted, long-sighted, that you are going to inherit them. Looking at the genetic relationship when it comes to eyesight problems, is there truth to this, that you can inherit these conditions?
Possibly, yes. You know, sometimes what happened, heredity, you know, it goes for both sides, father and mother, you know. If father is short-sighted and mother is normal, so maybe 50% child can be short-sighted, but not 100%. So it's happened. It could be heredity or it could not be heredity.
All right. So, but there is a chance of heredity coming into play. All right. Now, let's move on from this whole conversation about myths and misconception. I will be sampling your views in a bit, but let's talk a bit about, you know, the corrective treatment options that are there for these common eyesight problems that we get to see. And I want to start with glasses. You know, it's the most common form of corrective procedure or treatment that most of us are given for eyesight problems. Let me come to you, Deepak. Looking at safety issues, how safe are glasses as an option for treatment? And why are glasses always the first recommendation that is given?
See, if somebody has gotten refractive errors, they have basically three options, the current medical science. One is the spectacle ad, then the second could be the contact lenses. Different kinds of contact lenses are there. And the third is the surgical part of it. We call it LASIK surgery, where people also call it to get rid of the refractive errors after the LASIK surgery. So these are the three options available. The most affordable and easiest way of correcting your refractive error is the spectacles. In terms of safety, yes, there are so many options available as the advancements are coming in the lens and the spectacle thing. But yeah, we have to look at the affordability also. Because from the childhood, if somebody has got spectacle in early age, as you said, the age of 6, the prescription keeps on changing as you grow.
Over the years.
Yes. It's more prevalent in the short-sightedness, the myopia. So every time, LASIK is not recommendable there because it can be done only once at a certain age group. There are so many requirements for the LASIK surgery. So you are remaining with the two options, that is the spectacle and the contact lens.
Contact lenses.
Again, if you're too young, handling the contact lens, hygienic part of it, or insertion, removable part of it, it could be a lengthy part for you, or you may need the help of your parents or so.
Yes.
But the spectacle is quite easy. Any time of the day or night, we are waking up or doing something, simply put on the glasses and your vision is back. The contact lens will take time to maintain the hygiene and wear it on. Then there is a lot of restrictions regarding that.
Okay.
So that's why the spectacle around the world is getting, has gotten already the most commonality.
Okay. Especially looking at safety issues, cleanliness issues. I mean, you as an individual have so much responsibility when it comes to contact lenses.
True. As
opposed to glasses. Now, let me come to you, Njoroge, and I'd like to just, for the benefit of our viewer, you could help us understand, the relationship that the Machua Waithaka Foundation has with the Overseas Friends of Batia Janta Association in line with offering eye care support for locals in your area.
As I said, it started when we got so many challenges of health as a result of the COVID-19.
Yes.
And we were overwhelmed. So many phone calls, so many letters of people asking for medical attention or something like that. And their child is sick, they don't even have money, they had lost their livelihood, jobs, and all these kind of things. They are not even selling in the market. So once as we were doing that, we were able to get to Dr. Sima. She has been coming to KBC on yoga, and we were able to track and wondering maybe how would we be able to do that. But fortunately, we were able to meet Ranjinda, the husband, who would introduce us to, she's the woman convener of the Overseas Batia organization. I mean, Overseas Batia Janta Association. And she's the woman convener. So as we were doing that, we were able to start fundraising for either food stuff. They would help us in food stuff, and they'll help us with some of the things that, like, even in the environment, because we're partly in the environment. And we realized that there was much commonality. We had so much similarities, and rather than the differences that we have within the organization. And the discourse was, this is the direction that we need to move towards. And we have had several meetings. And with our meetings with them, they introduced us to the doctors. And the doctors came and had our challenge. They had our cry. So why should we, actually the question was, why should we do firefighting? Why not get there, do preventive therapy if it is preventive, talk about health issues. Let's tell people some of the diseases, Deepak and Mukesh will tell you, some of the problems are because we don't take care of ourselves. If we would listen, maybe 50% of the problems would go. So there was that kind of health talks that we had. And once they came to the ground and visited our sub-county, they realized that there was much. People don't know. The first thing is not that people are not even taking care of their eyes. Even right now, I've just realized that even closing the eyes is an exercise that we're supposed to be doing. I was doing it for fun. But you see how this knowledge is shared? Because they have the knowledge. We had the structures on the ground. We have people working on the ground. We have the organization. But we were also limited because we didn't have any person who is in the medical field. So we would go there as community development workers. That was the case. So we realized that we need expertise partnership. And that is how they came in. And that is how we started having that rapport that would be talk, we would share, they would send us, tell us, these are the indicators, this is what you look at. And we realized, surely, we have these problems.
Absolutely.
We didn't know. It's like if I don't tell you anything about it, you wouldn't even know that you have it. So we realized, and they came on board. They have been assisting us in distribution of food stuff, even in taking care of families. And through that, we realized which is the easiest way to go. Let's go health. And through this, the easiest way, because they are the word, let me not betray my English kind of like, but your roots or something like that. But with the optical knowledge they have and the area that they have studied in, we realized that we would have them, and it came as a surprise. And they told us, okay, we will go there. We're going to have, through the chairman, Mr. Hiran. Narim Hiran. You would excuse me for that. And
well understood.
and that is when we realized, they came, and the chairman came and said, we are going to support you. Actually, they've never even worked in Kiambu. And they were going to complement what we were doing. But now they brought in that we will be having a medical camp every month, an eye clinic camp every month in Kiambu. In the forwards, we will start in Riabai. And that is how the whole of this came. We looked at the similarities rather than the differences.
Yeah,
and that is
what brought you together.
And this is what brings us together. It doesn't matter who he is, what he is. And again, our differences also make us similar. Complementers.
And let me come to you, Muktesh. Looking at this gap of information, especially looking at eye care, what is it that also drew you as an association to wanting to be part of helping the community there?
That we are trying to do it. You know, what is our plan? Plan is, you know, we start slowly, that like this time we are going to very limited people because this camp was arranged in a short time. Are you getting me?
Yes.
So we are trying to do as much as possible. That's why, as you mentioned, every month we are going to cover. So except Kiambu, maybe with some other county we should also visit to advise the people how to go ahead.
All right. And Deepak, let me come to you. Looking at the drive and the campaign that you are hoping to, that you have been on, what is it that you want the locals to know that is being offered there? What services are you offering for the people?
In terms of the eye health, first of all, we'd like to make them aware about the hygiene of the eyes and the common preventable blindness which they might be going through. And they're not aware it can be prevented. It can improve their lifestyle and all that.
Okay.
Especially in children, we see they're not aware up to a certain age when they are in the school, preschool age and all that. Unless teacher is complaining or the parents have noticed it that the children is not visually as good as the other kids. So if we are going towards them or in the particular place where this kind of facilities are very limited, we can pick up such kind of preventable blindness through the screening process, and we'll advise them further how to go about it, how to treat their eyes, keep the hygiene, proper hygiene of the eyes. That's basically awareness and giving them the bit of the treatment, whatever is possible in such kind of setup.
Okay, and let me come to you, Njoroge. You know, in as much as there's this the free eye camp going on and the services that are being offered, there's still a financial implication that the locals have to deal with when it comes to treatment that is needed after condition has been detected, and for most it would mean getting glasses. How is this being addressed, and how are they being helped to get the glasses that they may need to correct the vision conditions that may have been picked up?
The Overseas Friends of Batia, Janta Association, have provided us with glasses. And they have donated the glasses to us. Initially, we expect that as time goes by, we'll be getting more glasses even from other well-wishers. But they have given us around 300 glasses. And with that, we expect that the conditions that we'll be able to treat at that particular moment, there will also be the component of referral. Maybe it's not everybody who will require glasses. So others is just maybe they don't even require medication. Others, there will be referrals. As the Machua Foundation, we look at the referrals, and we're encouraging Kenyans, wherever they are, that the NHIF card is very, very important. Because if most of us have that card, I think you can even go to any hospital or any other hospital. So it is that raising that awareness that if this one would be there, this is the direction that we're supposed to follow. This is how easy it is to get treated.
Yeah.
So most of it could be, I don't want to call it ignorance, but maybe the dissemination of information has not been done properly. And this is why we are coming in as the foundation. How do we link these two gaps? How do we also complement the services that the government is offering?
Yeah.
So we are into that. We are into that kind of system where
harmonious way of working.
Where we believe that, in fact, even in Kenya, like you remember, if I would just take you back.
Yes.
If we listened to Wangari Maathai about the trees, would we be complaining about, if she had all the resources maybe to even go down, would we be having a problem of climate warming? You can imagine that time. So this is now us. It is our health. It is our children's health. It is our eyesight.
Yes.
You look, as he has said, I've talked about children. A child might not even will be complaining of a headache. You might think that child is just joking around, or maybe doesn't want to go to school, but they couldn't have that problem with the eyes. So with the technology they are coming in with, and the equipment, it is electronic eye testing.
Okay.
They will be able to detect those challenges. So we might even be saying that our kids are not even performing in school. But you can imagine a child who was, before even you got your glasses, there was a challenge that you had.
Yeah.
So you can imagine a child who does not realize, or the parent does not realize that this is the challenge that the child has.
You can't see in class.
So you'll be calling your child stupid. It is bringing a whole humanity, a sea of humanity together. Let's see what we can do as ourselves. Let's see what we can be able to learn. Let's also get to that culture of learning about the challenges that are facing the people on the ground, and see how we can be able to help. Maybe that is not your first pair of glasses. You could have another pair of glasses at home. And it is just there. You don't use it because maybe your eyes adjusted one way or the other. But that is a gift to somebody else.
Yes, and that brings me to this next aspect of making sure that, the reality is there's always someone somewhere looking to exploit a good cause. Someone looking to take advantage of something good that is meant to help other people. And from your point of doing things, as a representative of the Machua Waithaka Foundation, what also measures are you putting in place to make sure that with the glasses that you have been given or have received, they are going to people who actually need them and not a know-you basis?
Well, we have volunteers on the ground. We're lucky that now we have community health volunteers.
Yes.
And those are the cases that we will be following. Then basically, whatever we've done is that they have what they have. At the ground, we're the people at the ground. We're the people at the grassroots. We will make sure, sometimes we even do home visit.
Yeah.
I can even give you a very simple case of what we witnessed just the other day.
Yeah, please.
We were just going around Dewberry ward. It's a ward within our place. And we found that there was a woman who is suckling 2 children, and one is not even hers. She is the sister's-in-law. Why is she doing that? Because the sister-in-law is mentally retarded. You see, and those are the critical cases. That is how deep we go in before we even identify. Nobody has even identified that. And again, through what we've learned and shared, we believe there is nobody who is so poor that they don't have anything to provide. And the other thing that we also believe in Machua Foundation is that there is too much for everyone.
Okay.
And there is enough for each and every person's need.
There's enough to go around.
But there's not enough for one person's greed.
Okay.
I could get the spectacles and keep them undercover and just say, okay, I have them. I'm just seeing them. What are they? What are they used for this? Then there's this sea of humanity. What does also my faith teach me? And again, there's one thing that you forget. If you've ever done something good to somebody, the satisfaction you get from a mere word, thank you, goes a very, very, very long way.
Okay.
And is it actually for your own benefit? Is it for that particular person's benefit? Look at it in the other direction. Okay, whatever I've done, I think I've benefited this other particular person. But essentially, it is for my own spiritual wellness.
Yes.
It is for my own happiness. And that is what we believe in.
Okay. Due diligence is important to just make sure that we are not misusing, the kindness that has been extended. Now, we are almost out of time, but I'd like for this question to be addressed, and maybe I direct to you, Deepak. There's someone, this is Dominic, who's asking on Twitter, I took a knock to my right cheek near the ear, and I now fear spinning objects with at least 2 bright colors. What could be the reason?
Sorry, please repeat the question.
I'm trying to read it as it has been written. I took a knock to my right cheek near the ear. And I don't know if he meant to write fear or feel or see spinning objects with at least 2 colors. What could be the reason?
Well, taking extremely on your either side of it, it might bring the objects as a double image, as called diplopia. But the light with the different color maybe could be the reflection of something. It can't explain some medical part of it, not really.
Okay. If he has any concerns, maybe go see an optometrist.
Well, primary investigatives.
Yeah.
Yes, from there, if it has been picked up his problem, that's better. If not, then he can further consult ophthalmologist.
Then there's Daisy, who's asking, please explain the relationship between diabetes and eye loss, very briefly.
Diabetes affects the whole body organs, and eye is one of them. So when the diabetes is having spikes going very much high and low, it affects the eyes quite a lot.
Yes.
The vision gets blurred, headache is obvious because of that. So if the diabetes has gone quite 3 or 4 folds above the normal range, vision is obviously getting blurred, and then vision to come back naturally to the normal status of whatever vision you had before, it takes like 3 to 4 weeks time. So if somebody is diagnosed with the diabetes unknowingly, they must keep their sugar level under control so that the vision doesn't keep
spiking up and down. Okay. Now, let me, maybe Muktesh, you could address this next question. Somebody is asking, how safe are eye drops that are meant to clear redness in the eyes? This is Kezia.
Well, it depends where they have got and how and why they were prescribed. And is it the proper medicine given to reduce the redness or those scar or not?
Yes. So it all depends with where you got it. Maybe you could seek further clearance from that. But I don't know, Deepak, do you have anything to add in regards to that, the safety of eye drops that are meant to clear redness?
Well, if it is necessary by the practitioners to prescribe in certain conditions, yes, it can be given.
Okay.
But nowadays, those redness clearance, those eye drops has become quite common. People are going over the counter and buying themselves because they want to show their eyes quite clear. And that's just like masking the underlying problem by putting on something. For example, if you have some underlying condition which is giving you a headache, which could be so many things, and you are just relying on the painkillers, that's not a good idea because you are masking the problem there. So we should look into the deeper part of it, why the redness is coming, what level of redness it is.
Okay.
And if the doctor has prescribed, it's well and good for a certain duration, but not for a regular use of it.
All right. Then there's a Ken who is asking, I have been trying to wean myself off glasses. I'm short-sighted and I get headaches when I don't wear my glasses. Is it only because I don't wear glasses, or could there be another problem? Deepak, maybe you could take that?
Again, so many factors. Depends how much short-sighted you are, and then what's your lifestyle. You take off your glasses and start doing your, again, digital activities, or spending time outdoor where is a lot of brightness. Photophobia can cause the headache there.
Okay.
Vision blurriness, of course, will cause some watering in the eyes, itching and such kind of things. So yes, it's a combined effect of not wearing glasses or leaving the refractive error unattended, and the other factors, the lifestyle, what you are doing basically.
All right. And this now is my personal question. When it comes to short-sighted people and wearing glasses, is it recommended to wear them throughout, or you should have intervals where you remove them?
Again, it depends on the amount of short-sightedness. Yeah, up to a certain stage where we call it a mild myopia, short-sightedness, yes, you can give some break. There are intervals you can do things without. Like if you are a mild myopic person and you're doing some activities like, let's say you are in the kitchen or doing some recreational activities, you don't need to wear that. But again, if your eyes are fixed to do certain work, like doing your laptop work, phone surfing and all such kind of things, better you put there so that you don't bring the devices close to your eyes and get more and more strain.
Okay.
But again, when you go to the moderate myopic person or to the higher, they become kind of like permanent thing. You have to wear throughout to perform your activities properly.
I think I fall in that category because everything is blurry once I take my glasses off.
True.
You know, I cannot read this far without my glasses.
So probably you are a moderate, or maybe looks like moderate myopic.
Oh, okay, I thought I was doing worse. Because I've always been with glasses. The only time I remove my glasses is when I'm taking a shower, and I always have them next to me there, and when I'm sleeping.
True.
All the other time, I have my glasses on. So if you need them throughout, it's okay to wear them. If you feel you want to give your eyes a break, it is also okay, right?
No, it's not a plain rule that you can stay without glasses in all the conditions. As I said, it is divided.
Okay.
Your practitioner or your optometrist or optician will rather advise you there. So in your condition, what you should be doing.
Okay. And one last question from Teshi. She's asking, sunglasses as part of anybody's basic eye care. Would you recommend for people to be wearing sunglasses as long as you're in the outside, even if you don't have any eye problems?
Yes, absolutely. Sunglasses are basically there for the protective reasons. And everybody needs protection from the outside harsh conditions. It could be UV radiations, dust, direct dust particles going on, strong wind and such kind of things. And also it's a fashion statement. So there is no restriction in the sunglasses.
Yes,
you can wear it as, yes.
All right. Well, thank you so much for your question, Wesley Kimutai Kiptanui, and it's a great discussion, very informative from E10. Thank you so much for tuning in. We appreciate you. Dominic, thank you so much for sending through your questions. That is all the time we had for this particular conversation. Thank you so much for staying with us. As we wind up, maybe you could start with you, Njoroge. Your closing remarks in regards to this campaign that you are on and what you would like the local people to know about this particular drive, very briefly.
Well, thank you again for that. What I would like maybe our people to know, and it is not maybe in the area that we're working, it's universal, health is universal, that we can be able to take care of our friends, we can be able to take care of anybody who has a condition, as long as you're willing. And with this, it does not require so much. And we'll also want to tell people that those people around will be visiting Wambui. The first place will be Wambui on Saturday. Would like to tell people not to, if you know that you can be able to afford, please, let us not be greedy. Let's allow those people who cannot be able to afford, get that opportunity. And we expect them to come in enough numbers because of the training that we're going to offer. We'll also offer training and some talks on health and eyes. And we'll start at exactly 9, and they're welcome. And we appreciate the efforts of the people of Wambui. They have supported us. And we also want to extend our appreciation to the Overseas Friends of Battery Janta Association for their work, and to Kenya as a whole. I would believe that we are one. And we're not going to use some, there are those misconceptions also. Deepak is called Anthony, and And Muktesh, you see, there is that conception that this is what is coming from India. They are Kenyans. They are part of the 42 tribe of Kenya.
Okay.
And we are working together for one cohesive and healthy Kenya.
All right.
In fact, I would like also, the last is that I would like to wish all Indians a happy Republic Day. Today is 26th, it's the Republic Day. I've actually been inculturated in the culture of India, wherever they are, and to the Kenyans, let's support each other. We've seen what our friends can be able to do. Let's also be able to do something for ourselves at whatever local level that we are.
Okay.
If it is giving the spectacles, if you have spectacles that you're not using, you can forward them to any organization that is around there. They can be used by somebody else, depending on the. But don't just share your spectacles. You know, there's also that habit that, okay, I used to have this problem when I was reading, then you share your spectacles with some, oh, this is the same problem that, you know, we are very good at doctoring ourselves, medicating ourselves.
Seek medical guidance before you go.
So we would rather take them back to an optician, who will be able to know the gauge and be able to give them to the person who actually needs them, who might not even be able to afford them.
All right. Let me come to you, Muktesh, in regards to just closing your remarks and messages to our viewers this morning, and more so when it comes to eye care.
Sorry?
What would you like to tell our viewers this morning as you're parting short, and more so looking at eye care and what we need to do to just understand that eye care is important?
Well, definitely eye care is important. You need to look for the right person who can advise you. You know, not to just listen from other people to put water or put anything, you know, in people, so many people say do this, do this.
Yeah.
Better to look a right optician or right optometrist or ophthalmologist who can give you a care. I mean the proper advice how to do the thing, not to listen other people.
All right.
At least listen the professional who can give you a better advice.
Okay. Seek professional advice. Deepak, your closing remarks in regards to this conversation about eye care.
Well, regarding this camp we are going to do, look, a certain number of people. So I would advise to welcome everyone. Whether you think your eyes are doing good or there is problem, everybody is going to get certain assurity from us that you do need medical assistance, whether further referral in terms of referral, or some of the problems will be sorted out there. But at least everybody will get assurity that the eyes are doing fine.
Yes.
We'll give some awareness regarding the eye hygiene, some maybe malnutritious conditions which is very prevalent, used to be very prevalent. Recently it has gone down, but at least the awareness will be there in the certain public sector where the people are not very much able to get such kind of medical attention or the knowledge, or that at least knowing about their eye health.
Okay. Thank you so much. We wish you the absolute best as you continue with this campaign that you are on. And remember, if you are able to get these services for yourself, allow those who are not able to get this assistance that they need. That brings us to a close of this conversation. We have been speaking with Deepak Anthony, who is an optometrist, and we also have Muktesh Gupta, who's also an optometrist, both of whom are members of the Overseas Friends of Batia Janta Association, and we also have Njoroge Aloysius, who is the project coordinator and a local partner representing the Machua Waithaka Foundation. Thank you so much, gentlemen, for being with us this morning.
Thank you. Thank you. Pleasure.
All right. So that is that in regards to matters health. But Good Morning Kenya is not yet over. Do stay with us. We'll be back with the next item for the day.